of seeing, has all the structures that it can see light, but really that information does not get to the brain. So that is a critical connection that is lost with glaucoma. And this process happens very slowly over a long time, and you have slowly reducing vision. That it can be so slow that it's difficult for someone to actually recognize that you're losing vision. And by the time you actually lose vision, it's too late, or you're actually blind. Remember, your vision can reduce through different levels to the point where you're called, you are categorized as blind. It's quite a large, spectrum there of different visual impairments. So it does progress slowly, but eventually causes blindness. Yes.
You also talked about how it is the leading cause of irreversible blindness. Does that mean that we have types of blindness?
Yes, because blindness can be reversible, irreversible. Thinking about it broadly, and just by the fact that something is irreversible and you're losing sight, it just really puts into focus the weighty issue of glaucoma in our society, and also the weighty issue of other types of irreversible blindness. It is the most common. There are other types, but I think for this discussion, it's very important to focus on that, because the other types are also very varied. Just like we have also reversible causes of blindness, like cataracts. I think maybe we'll have a session to talk about that. Very common in our society. A person can be very blind, can be blind 1 minute. In a few 15-20 minutes, a patient can see through an operation. So yes, you can have blindness that is reversible and that which is irreversible.
And maybe in another session we'll maybe focus on some of those types. But today, let's just focus on glaucoma. What are the types of glaucoma? Because I am informed that there are different types.
Yeah, so there are different types of glaucoma, and there are different ways to look at it. But broadly speaking, you categorize glaucoma as the adult type of glaucomas. You also have childhood types of glaucoma. And within these categories, you can further categorize them as either primary glaucoma or secondary glaucoma. And even within this group, there are different clinical types which will leave to the clinicians. So for today, let's focus on that. We have the adult type, we have the childhood types, and within these groups, the glaucoma can be primary or secondary. So what do we mean? Adult type, of course, these are adults. Children, usually we cut it off at about 16 years. So below that, within that, you have glaucoma that can occur in newborn babies. Okay, right from the point of birth, they can have glaucoma, or it also develops slowly as they grow older, as they develop. And for adults, with increasing age, that's also some changes are happening in the eye that can actually lead to glaucoma. So when you say primary glaucoma versus secondary, primary glaucoma is glaucoma that comes about in an eye that has no either concurrent or history of illness or injury or any anomalies in the eye. So these are perfectly normal eye, okay, that at some point develops that condition. While secondary glaucoma is a glaucoma that comes because of some other issues going on in the eye. Actually, not only in the eye, but also in the body, that could be making you more prone to having this condition. So that's what we mean by primary and secondary. And within this, there are many different types. Like I mentioned, the childhood glaucomas can occur right from birth. We have, for example, secondary glaucomas. That's very common. I had mentioned cataracts before. So cataracts also, depending on the type and all that, and just the nature of your eye, you could